All India Radio presents Morning News. Good morning, I'm Sunil Verma and with me is Tanvi Khurana. The headlines. Prime Minister Narendra Modi lauds efforts of medical teams in containing COVID-19 pandemic to a great extent. Says bringing treatment to patients' doorstep will reduce burden on health system. Centre asks states to review their preparedness for prevention and control of black fungus. Health Minister Harshvardhan says India's entire adult population will be vaccinated by end of this year. UK launches third booster dose trial of 7 corona vaccines. Karnataka government extends lockdown till 7th of June. RBI approves transfer of 99,122 crore rupees as surplus to central government. And Nepal President dissolves Parliament, announces elections on November the 12th and 19th. As the number of COVID cases is on the rise, we appeal to our listeners not to lower their guard, take all precautions, and all those above 45 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in details. Prime Minister Narendra Modi has lauded the efforts of medical teams in containing COVID-19 pandemic to a great extent. Mr. Modi, however, warned against complacency and urged them to engage in fighting a long battle by focusing on rural areas. The Prime Minister was interacting with doctors and officials of Varanasi in Uttar Pradesh through video conference yesterday. Mr. Modi provided a new mantra in COVID management, Jahan Bimar, Wahin Upchar. The Prime Minister said, bringing the treatment to the patient's doorstep will reduce the burden on the health system. He also hails the initiative of micro-containment zones and appreciated the home delivery of medicines. Mr. Modi requested health workers to make this campaign as comprehensive as possible in rural areas.
महामारी के इस हमले को आपने काफी हद तक संभाला है, लेकिन अभी संतोष का समय नहीं है। हमें अभी एक लंबी लड़ाई लड़नी है। अभी हमें बनारस और पूर्वांचल के ग्रामीण इलाकों पर भी बहुत ध्यान देना है। और अब मंत्र हमारा क्या होगा? हर व्यवस्था के लिए, हर इकाई के लिए नया मंत्र यही है, जहां बीमार वहीं उपचार। ये हम भूले नहीं, जहां बीमार वहीं उपचार। जितनी हम उपचार उसके पास ले जाएंगे, उतना हमारी हेल्थ व्यवस्था पर दबाव बहुत कम होगा।
Mr. Modi commended the work done by the doctors, nurses, technicians, ward boys, ambulance drivers and other frontline health workers of Varanasi.
कोरोना के इस कठिन समय में हमारे काशीवासियों ने और यहाँ काम कर रहे हर एक जन ने वाकई इस कथन को सार्थक सिद्ध किया है। आप सभी ने शिव की कल्याण भावना से ही काम करते हुए जन जन की सेवा की है। मैं काशी का एक सेवक होने के नाते हर एक काशीवासी का हृदय से बहुत बहुत धन्यवाद देता। विशेष रूप से हमारे डॉक्टर्स ने, नर्सेस ने, टेक्नीशियंस, वार्ड बॉयज, एम्बुलेंस ड्राइवर, आप सभी ने जो काम किया है वो वाकई सराहनीय है।
Mr. Modi emphasized on the important role played by ASHA and A&M sisters in the ongoing war against COVID-19 in the villages and urged health officials to take maximum advantage of their potential and experience. The Prime Minister said that during the second wave, the frontline workers have been able to serve the people safely because they were already vaccinated. He urged everyone to take the vaccine when their turn comes.
सेकंड वेव में हमने वैक्सीन की सुरक्षा को भी देखा है। वैक्सीन की सुरक्षा के चलते काफी हद तक हमारे फ्रंटलाइन वर्कर्स सुनिश्चित रहकर लोगों की सेवा कर पाए। यही सुरक्षा कवच आने वाले समय में हर व्यक्ति तक पहुंचेगा। हमें अपनी बारी आने पर वैक्सीन जरूर लगवानी है। कोरोना के खिलाफ हमारी लड़ाई जैसे एक सामूहिक अभियान बन गई है, वैसी ही वैक्सीनेशन को भी हमें सामूहिक जिम्मेदारी बनाना है.
The Prime Minister cautioned against the new challenge posed by black fungus in the battle against the pandemic. He added that it is important to pay attention to the precautions and arrangements required to deal with it. The Prime Minister paid tributes to all those who lost their loved ones.
In view of the rising cases of mucormycosis, known as black fungus, Union Health and Family Welfare Ministry has advised all the states and union territories to review their preparedness for prevention and control of this fungal disease. Union Health Secretary has written a letter to Chief Secretaries and Administrators of all the states and union territories. Mucormycosis is a fungal complication being detected in COVID-19 patients and affects mostly those who are suffering from diabetes. In the letter, the Union Health Ministry has asked states and union territories to establish the Hospital Infection Control Committee and designate an Infection Prevention and Control Nodal Officer. It has also asked to prepare and implement Infection Prevention Control Program in hospital and health facilities. The ministry has urged for adoption of standard precautions across hospitals and health facilities. The Health Ministry has stressed on meticulous adherence to infection prevention and control while managing immunocompromised patients such as COVID patients having comorbidities. Amid growing cases of black fungus, Uttar Pradesh government has declared the deadly infection as an epidemic. Chief Minister Yogi Adityanath took the decision after a review meeting yesterday. The state has so far registered more than 150 cases of mucormycosis. The Chief Minister said that medicines for the treatment of black fungus should be made available in every district. He said that officials must ensure that there should be no black marketing or hoarding of the medicines needed for the treatment of this disease. Himachal Pradesh government has also declared mucormycosis as an epidemic.
Health Minister Harshvardhan has said that India will be in a position to vaccinate its entire adult population by the end of this year. He said health facilities are being upgraded upon the speculation that the virus might mutate in future and endanger children. During a COVID review meeting, Dr. Harshvardhan said, between August and December this year, India will procure 216 crore vaccine doses, while by July this year, 51 crore doses will be procured.
We are in the very active process of helping various manufacturers of the vaccines, the new vaccines, to ramp up their production, to help them financially also in the development of their capacities. Between 16th of January and 31st of July, the country would have got 51 crore vaccines, and then between 1st of August to 31st of December, the country would have got almost 216 crore vaccine doses. That means that by the end of this year, we would have got the capacity to vaccinate almost every adult in the country.
The Health Minister reviewed public health response to COVID-19 and progress of vaccination in Chhattisgarh, Goa, Himachal Pradesh, Puducherry, Andaman and Nicobar Islands, Chandigarh, Dadra and Nagar Haveli and Daman and Diu, Ladakh and Lakshadweep yesterday. India has administered more than 19 crore 32 lakh doses of COVID-19 vaccine in the country so far. The Union Health Ministry said that more than 13,83,000 beneficiaries were inoculated with COVID-19 vaccine doses yesterday.
In a first, the United Kingdom has launched a new clinical trial that will assess the efficacy of a third booster dose of 7 different COVID-19 vaccines on patients' immune responses. The trial will assess COVID-19 vaccines of Oxford AstraZeneca, Pfizer BioNTech, Moderna, Novavax, Valneva, Janssen and CureVac. The trial, named CovBoost, aims to begin in June and recruit 3,000 people of all ages who had their first dose in December or January to test if this is worthwhile. It costs £19.3 million and is being funded by UK government and led by the University Hospital Southampton NHS Foundation Trust. The trial will be conducted at 18 sites across the UK, and half doses will also be tested. Besides data on side effects and immune responses, the findings will also help vaccine advisors decide if revaccinating some people in the autumn is necessary. The participants will be asked to keep diaries of any side effects after a third dose, and their immune responses will be tested after 1, 3 and 12 months. You are listening to the morning news on All India Radio. A reminder of the headlines once again. Prime Minister Narendra Modi lauds efforts of medical teams in containing COVID-19 pandemic to a great extent. Says bringing treatment to patients' doorstep will reduce burden on health system. Centre asks states to review their preparedness for prevention and control of black fungus. Health Minister Harshvardhan says India's entire adult population will be vaccinated by end of this year. UK launches third booster dose trial of 7 corona vaccines. Karnataka government extends lockdown till 7th of June. RBI approves transfer of 99,122 crore rupees as surplus to central government. And Nepal President dissolves Parliament, announces elections on November 12th and 19th. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
Karnataka government has extended the lockdown in the state till 6 a.m. on the 7th of June. Chief Minister B.S. Yediyurappa said the decision was taken at a high-level meeting with senior officials and ministers. The existing lockdown was supposed to end on the 24th of this month. The Karnataka Chief Minister also said that the state government has decided to give free treatment for mucormycosis patients in the government district hospitals. The Karnataka government will also resume COVID-19 vaccination for 18 to 44 age group from today. During the program, frontline warriors will be prioritized over other eligible beneficiaries. In Ladakh, Corona curfew has been extended in Leh and Kargil districts. It has been extended in Leh for 14 days, while that of Kargil for 7 days. More from our correspondent.
Leh DDMA Chairman Shrikant Suse announced complete restrictions on all kinds of activities and movements on Saturday and Sunday. During the 14-day lockdown, no public dealing is allowed in government offices. All movement passes are withdrawn by the district authorities. Fresh passes will be issued on online against application. While wholesalers are allowed to transport goods between 5 to 8, the essential shops remain open from 7 to 11 in the morning. On the other hand, Kargil DDMA Chairman Santosh Sukhdeva announced extension of Corona curfew till 31st of May. Ramesh Chandra, All India Radio News, Leh.
The Madhya Pradesh government has extended the corona curfew in Bhopal till 31st of May. The number of active cases in the state is 67,625, while positivity rate declined to 5.6%. More on this from our Bhopal correspondent.
The decision to extend the corona curfew has been taken in a meeting of the Bhopal Crisis Management Team. The corona curfew, which was supposed to end on May 24, has earlier been given multiple week-long extensions since April 12. Chief Minister Shivraj Singh Chauhan, while reviewing a corona control meeting, has said that by the end of this month, corona positivity must be wiped out in all the districts of the state so that from the next month, life in the state can be normalized and work can be started. The state on Friday reported 4,384 new cases and 79 deaths, while 9,405 patients recovered from infection. Pooja Pivardhan, AIR News, Bhopal.
In Chhattisgarh, the second wave of COVID infection has slowed down, with daily positive cases declining to less than 5,000 after a span of 1.5 months. The number of deaths has also come down to less than 100, while the state's average test positivity rate has dropped to 8%. 14 districts of the state have registered a positivity rate of 8% or less. More on this from our Raipur correspondent.
In Chhattisgarh, on an average of 65,000 samples are being tested daily for identification of corona-infected patients. In the last 1 week, more than 4,56,000 samples have been tested. COVID vaccination campaign in the state is also continuing vigorously. More than 6,66,000 people in the age group of 18 to 44 years have been inoculated with COVID vaccine. Special preparations are being made for the treatment of children in hospitals hospitals of various districts in view of the possible third wave of corona infection. A 25-bed child ICU is being set up at COVID hospital in Durg district. Vikalp Shukla, AIR News, Raipur.
Bihar is witnessing a marked decline in fresh COVID-19 cases. 5,159 positive cases were reported during the last 24 hours, while 10,152 patients have recovered. Recovery rate has risen to over 91%. Health Minister Mangal Pandey said active cases in the state stood at 49,311.
बहुत स्पष्ट है कि कोरोना के संक्रमण का जो प्रभाव बढ़ रहा था वो अब घट रहा है और स्वास्थ्य विभाग के चिकित्सक और हमारे चिकित्सा कर्मियों ने सुदूर क्षेत्रों तक जाके इन सभी जगहों पे बेहतर स्वास्थ्य प्रबंधन किया, उसका परिणाम है। साथ ही जो लॉकडाउन हुआ उसके कारण जो लोगों का मिलना जुलना कम हुआ, लोगों का बाहर निकलना कम हुआ, उसका भी लाभ हमको मिला और आज निश्चित रूप से राज्य के अंदर देश के कई राज्यों से इस दूसरे दौर में बेहतर स्थिति है।
Odisha government has modified the global tender for COVID-19 vaccine procurement already floated on the 14th of this month. Provisions like relaxation in earnest money deposit, bid security and liquidated damage have been incorporated in the bid document to attract the bidders. These amendments have been approved by the state cabinet chaired by Chief Minister Naveen Patnaik yesterday. We have a report.
In order to achieve its target of vaccinating the intended population within the period of 4 months, the state government has come out with these fresh amendments in the global tender to make it more bidder-friendly. Meanwhile, the state yesterday witnessed single-day highest spots both in terms of infection and fatalities. While a record 12,523 persons were infected in a single day yesterday, a record 27 persons too lost their lives to COVID-19 during the last 24 hours. Even as the state's COVID-19 active caseload has jumped beyond 1,09,000. It's all set to conduct a statewide door-to-door survey from Monday next to trace COVID symptoms and comorbidities in people to help bend the viral trajectory downward. Girish Chandra Das, AIR News.
Maharashtra government has launched the Mission Oxygen Self-Reliance Scheme to meet the state's oxygen needs. Special incentives will be given to oxygen-producing industries under this scheme. Here is a report.
In order to meet the increasing demand, state government has declared few incentives to meet the target of producing 3,000 metric ton of oxygen per day. Units set up in Vidarbha, Marathwada, Dhule, Nandurbar, Ratnagiri and Sindhudurg regions will be eligible for incentives up to 150% of their eligible fixed capital investments, and units set up in rest of Maharashtra will be eligible for up to 100% general incentives. The government will also give a refund on gross SGST, stamp duty, electricity duty and unit subsidy of power cost for 5 years and interest subsidy for MSME units with a fixed capital investment of up to rupees 50 crore. Only those applying before June 30th will get the benefits of this policy. Madhuri Pange, AIR News, Mumbai.
Various organizations and individuals are working in Maharashtra to provide help to corona patients and frontline workers. In Dhule district, nurses have set up food bank, while in Nashik, a music group is providing free tiffins to the employees of crematorium. Our Mumbai correspondent has filed this report.
Doctor, nurse and other healthcare workers are continuously providing services to corona patients. But nurses from Dhule districts of Maharashtra have not forgot responsibility for the society and formed a food bank. Through this food bank, they are helping domestic workers by providing various grocery items sufficient for a week. Besides this, they are also providing sanitary pads to them. They are planning to provide such a help to tribals situated in Satpura range. In Nasik district, a music group, Gadvat Dhol group, is providing tiffins to crematorium workers. They are providing free tiffins to the workers of 8 to 10 crematoriums. Member of a group, Amol Dhade, says till date they have provided more than 26,000 tiffins in last 1.5 months. With Nitin Jadhav from Dhule and Sanjay Pathak from Nasik, this is Jeevan Bhavsar, AIR News, Mumbai.
The ongoing pandemic has brought the society together to fight against the invisible enemy. People are helping the society in whatever way they can. One such example is of a 99-year-old Lance Naik, Keshu Lal Verma, an army veteran who donated 1 lakh rupees towards the fight against COVID-19. Speaking to All India Radio News, he said people should not lose hope and keep living the life with a positive attitude. We have a report. Lance Naik Keshalal Verma was enlisted in the Royal Indian Army on 13th November 1940. He served in the Royal Indian Army Service Corps, Southeast Asia Command prior to the independence. Earlier this week, the veteran handed over a cheque of 1 lakh rupees to the station commander of Army at Jalandhar Station for fight against the COVID-19 pandemic. Talking to All India Radio News, he said his life is dedicated to the service of nation.
मैं फौजी हूँ। मेरा मन हमेशा लोगों की सेवा बढ़ाई देश सेवा के लिए। मैं चाहता हूँ कि अपनी पेंशन से मेरे भाई जो इस नामर्द बीमारी में मुब्तला है उनकी सेवा हो सके तो मैं अपने आप को बड़ा सौभाग्यशाली समझूंगा।
Samaritans like Lance Naik Keshalal instill a sense of confidence in the society and will collectively help in defeating the virus. Diksha Saxena for AIR News, Delhi.
The Reserve Bank has approved the transfer of 99,122 crore rupees as surplus to the central government for the accounting period of 9 months ended 31st of March. The RBI also decided to maintain the contingency risk buffer at 5.5%. The decision was taken at the 589th meeting of the Central Board under the chairmanship of RBI Governor Shaktikanta Das through video conference. The central government has notified and revised the rate of variable DNS allowance VDA with a view to provide relief to different category of workers engaged in various scheduled employments in the central sphere. The Labour and Employment Minister Santosh Gangwar said that this will benefit about 1 crore 50 lakh workers. The hike will be effective from 1st of last month. The VDA is revised on the basis of average consumer price index for industrial workers, CPI-IW, a price index compiled by Labour Bureau.
The government has said that 17% more wheat has been procured during current Rabi marketing season in comparison to corresponding period last year. The Consumer Affairs Ministry said a quantity of over 382 lakh tons of wheat has been procured against the last year corresponding purchase of 324 lakh tons. The Railways has earned 18,542 crore rupees from freight loading in the current financial year. The Railways Ministry said it is 4.92% higher than 2019 earning from freight, which was 17,674 crore rupees and 75.93% higher than 2020.
Indian Navy's first destroyer, INS Rajput, was decommissioned at Naval Dockyard at Visakhapatnam yesterday after serving the nation for 41 glorious years. The ship was decommissioned in a solemn and low-key ceremony due to the ongoing COVID pandemic as the national flag, naval ensign and the decommissioning pennant were lowered at sunset time. INS Rajput was commissioned in May 1980 at Poti in Georgia as the lead ship of the Rajput class destroyers of the Indian Navy. In cold, arid region Ladakh, agroforestry is the buzzword. In every spring season, mass plantation is carried out in eastern Ladakh's Changthang for the last 7 years. In the series, as a part of Golden Jubilee celebrations of AIR Lay Services, here is a positive story from Ladakh.
Agroforestry is relatively a new sector in Changthang. In these cold high-altitude areas of Ladakh, growth of plant is sluggish due to extreme harsh weather. However, Changthang has no dearth of land or water resources. With these two preconditions for plantation, the people in Changthang are defeating all the odds of high altitude and harsh climatic hindrance to grow agroforestry. Durbuk Range Officer Namgyal Tashi says plantation of over 10,000 saplings in various departmental areas are planned in Durbuk block in this financial year. He says,
दुर्बुक फॉरेस्ट रेंज में चांगथांग के आवाम में पहले के मुकाबले में प्लांटेशन करने में काफी चेंजेस आया हुआ है। लोगों में उत्साह है, इंटरेस्ट है प्लांटेशन करने में और काफी अवेयरनेस भी आया हुआ है इम्पोर्टेंस ऑफ एनवायरनमेंट के बारे में भी।
With an aim to create sustainable livelihood and increase vegetation in this cold desert region, the plantation of Sibakthorn also started after successful experimenting its growth in cold desert. With Ramesh Chandra, this is Young Chandolma for Air News from Leh, Ladakh.
Nepal President Bidya Devi Bhandari has dissolved parliament and fixed general elections in November amid a worsening COVID-19 outbreak. A presidential statement issued last night said neither the caretaker Prime Minister KP Sharma Oli nor opposition leader Sher Bahadur Deoba were able to demonstrate a majority to form a new government by the Friday deadline set by President Bhandari. The statement said that the President has dissolved the House of Representatives and ordered the first phase of general elections on 12th of November and the second phase on 19th of November. It said the decision was made on the recommendation of the Cabinet headed by caretaker Prime Minister Oli, whose December 2020 dissolution of Parliament sparked weeks of protests and was reversed by the Supreme Court as unconstitutional in February. U.S. President Joe Biden and his South Korean counterpart Moon Jae-in have stressed the need to engage North Korea in dialogue over its nuclear weapons program urgently. At a joint news conference in White House, the two leaders said the complete denuclearization of the nuclear peninsula is their goal. President Biden said both U.S. and South Korea are deeply concerned about the situation. The two leaders also discussed China and Taiwan. Hockey India has been recognized with the ATM Glitchich Award by the International Hockey Federation FIH during the virtual conference organized as part of the 47th FIH Congress yesterday. The FIH honorary awards are given to individuals, teams and organizations for their outstanding contributions to the sport of hockey.
And now let us take a look at the weather forecast for today. The national capital Delhi will have generally cloudy sky with light rain or drizzle with a maximum temperature rising up to 37 degrees Celsius. It recorded a minimum of 22 degrees. Mumbai is likely to have a partly cloudy sky with the upper level of temperature as nearly 34 degrees Celsius. Chennai is expected to have thunderstorm with rain. Kolkata may have a partly cloudy sky. Jammu will have a mainly clear sky becoming partly cloudy towards afternoon or evening. The temperature will rise from a minimum of 18 degrees Celsius to a maximum of nearly 36 degrees. Srinagar will have a partly cloudy sky with the possibility of rain or thunderstorm or dust storm. Leh may see a generally cloudy sky with temperature moving from 3 to 19 degrees Celsius. Gilgit will have a generally cloudy sky. The temperature will rise up to 29 degrees Celsius with a minimum of 15 degrees Celsius. Muzaffarabad is expected to have a mainly clear sky becoming partly cloudy towards afternoon or evening.
And now an overview of today's newspapers. The top headline in the Asian Age reads, PM's new doorstep strategy. Jahan bimar, wahan upchar. Black fungus new challenge, says PM in talks with doctors, reports Hindustan Times. Vax doses cross 19 crore. Maharashtra, UP, Rajasthan top the list. Headlines The Times of India. Positivity rate slips below key 5% mark, reports Hindustan Times. Desi COVID antibody test kit just at 75 rupees. DRDO product to hit market in June. Headlines The Pioneer. The Economic Times quotes IMF as saying that India needs to order 1 billion jabs to cover 60% of population. Jaishankar in US next week on vaccine mission for India and neighbours, reports the Indian Express. SC upholds government directive on personal guarantees. Ruling paves way for lenders to file bankruptcy petitions against promoters, writes the Business Standard.
And now before we end the bulletin, the headlines once again. Prime Minister Narendra Modi lauds efforts of medical teams in containing COVID-19 pandemic to a great extent, says bringing treatment to patients' doorstep will reduce burden on health system. Centre asks states to review their preparedness for prevention and control of black fungus. Health Minister Harshvardhan says India's entire adult population will be vaccinated by end of this year. UK launches third booster dose trial of 7 corona vaccines. Karnataka government extends lockdown till 7th of June. RBI approves transfer of 99,122 crore rupees as surplus to central government. And Nepal President dissolves Parliament, announces election on November the 12th and 19th. And with that, we end the morning news. Have a nice day.